All right. In order for us not to waste so much time, we will be starting the webinar right now, and hopefully others will join us along the way. So good evening once again, everybody. My name is Amanda Yado Ugoji, and I will be the moderator for today's webinar. I would like to confirm if everyone can hear me. If you can, kindly, use an emoji in the chat box, please. Thank you. All right. So moving on, this is one of the many webinar series hosted by the Foundation for Cancer Care. And today we will be looking at Mind Matters, the psychological aspects of the cancer journey for caregivers. So the theme of today's webinar is Mind Matters, Nurturing Cancer Caregivers, Nurturing Caregivers' Mental Health Journey in the Cancer Space. Here is just a brief breakdown of how our webinar is going to go today. There will be a period for experience sharing as we have caregivers in our midst, both medical practitioners and family members would be able to, briefly share their experiences about how they've been able to deal with their mental health while taking care of their, family members or patients dealing with cancer. After that, we're going to have a talk by Vineva Mbanusi from Unforsaken House of Hepzibah, a psychologist services based here in Lagos. And there would be opportunity for questions and answers. But while the talk is going on, kindly feel free to leave your questions, your comments in the chat box. After the talk, your questions will be attended to. So the objective for this webinar, so why are we having a webinar today? First of all, we'd like to raise awareness and understanding of the impact that caregiving has on the cancer journey. Many of the times people don't necessarily understand, or they are not even aware on the impact of caregiving on their mental health while they take care of their family or their patients with cancer. So we'd like to use this opportunity to raise awareness and help people to better understand the impact of caregiving rather on people's mental health. Then secondly, we'd like to equip caregivers with practical coping strategies and support mechanisms to navigate their mental health journey effectively. And lastly, we would like to use this avenue to build a supportive community and connection amongst caregivers. For some of us who know, Foundation for Cancer Care and Lakeshore Cancer Center currently have a support group for cancer patients. So this would be another avenue to, have caregivers, especially family members, to be part of our support group where we can, always offer support from like what we're doing today, psychological support, social support, and other forms of support to boost ourselves while, taking care of our loved ones while they deal with cancer. Okay, so today we have, as I mentioned earlier, we have Vineva Mbanusi as our guest speaker. She is a psychologist with a BSc in psychology and guidance counseling. She's also a teenage and child psychologist and an in-house psychologist at the Unforsaken House of Hepzibah. She obtained her degrees in Nigeria with 5 years working experience in mental health counseling, psychotherapy, developmental psychology, and youth mentorship. She adopts psychological skills that will enhance individuals' coping skills, mental wellness, adjustment skills, productivity, and interpersonal relationships. She also works with clients who are saddled with varying degrees of mental conditions in reducing and relieving the distress level of their challenges. Her experience in areas of psychology and clinical field has equipped her with the tools and skills in working with individuals to live productive and healthier lives. She has successfully with individuals. She has successfully worked with individuals cope with anxiety, depression, stress, trauma, grief, eating disorders, and other mental health problems. She has a developed passion and drive to work with people in finding solutions to their psychological, psychosocial, emotional, educational, and other life-related challenges. Her interests and expertise in the field include, but are not limited to, coping with depression and anxiety, grief and trauma management, coping with daily stressors, and others. She enjoys working with children and adults alike. So before we go into the talk by Ms. Pinella, we would like to, open the floor for anybody, 2 to 3 people, just in 5 minutes to, share an experience of how it has been caring for either a loved one, a family member, or a patient with cancer, your challenges and how you have been able to cope with those challenges. So the floor is open. If you would like to speak, kindly turn off your mic and speak. Thank you. Okay, so I'm hoping we all can hear me because the floor seems very cold and quiet. And I for one know that there are many, clinical staff here and other family members who would have one or two to share. I wouldn't like to call names, but I would like us to, be willing and free. This is a safe space and we are all here to help one another cope with our mental health journey. So before we hear from the psychologist, we would like to hear from us individually how we have been able to manage caring for our patients and our loved ones while it has had an impact on our mental health. So please kindly feel free to speak. Thank you. Okay, so it seems I will start since everybody's shy to, begin. Okay, working within the developmental space as a programs officer with Foundation for Cancer Care, um, I wouldn't directly say I'm a caregiver per se because I don't directly render any clinical assistance to any of our patients. But communicating with patients from time to time, getting requests for funding and going out there to create awareness and reaching out to people. I have realized that over time it has taken some a certain toll on my mental health and from the point of not I wouldn't say depression, but sometimes it just weighs me down knowing that there are a lot of people out there that need help and I can do little to quarter of and offer the help that they need. So personally what I do is a lot of times as individuals, you need to take time out to recharge and take care of yourself so you can be able to serve others better. So for what I do, how I cope is I try to, create time for myself to declutter all the emotions I feel during the week. So I take some time Friday evenings and I just sit through and, go through all the people I had to relate with during the week, people who called regarding needing help, people who just called because they needed somebody to talk to, and, all the emotions that came out of it, I sit down and try to decipher everything and allow myself feel it because I realized not allowing myself feel those emotions actually take a worse toll on me because after a point in time, it's just all so cumbersome. So I take time to feel it. If I need to cry, some days I cry. So that's how I cope for myself. And hopefully with today's webinar, I will get to learn if what I'm doing is healthy enough or and learn also other coping mechanisms and how to, do better. So does any other person have anything to say before Vinella takes the floor? You don't have to turn on your videos. You just have to unmute yourself and speak. Thank you. Okay, Dr. Ebuka, do you have anything to share with us? Being a doctor actively working on the field, so do you have one or two to share with the house?
Hello, good afternoon, everybody. Can you hear me?
Yes, we can hear you. Good afternoon, Dr. Ebuka.
Okay, so good afternoon, everyone. So, I'm really, where do I start from? It's just a lot, there are a lot of experience. Managing ourselves as well as managing the patients, so we're trying to deal with our own mental state as well as, the patient's mental state. So, it's tough, it's not easy. At first it looks interesting, but over time, you get burdened by, the amount of pressure you have to deal with mentally, so I mean that's really what I can say. I don't have to, go into more details.
Okay, thanks for sharing, Dr. Ibuka. And I believe and I hope that this session would be insightful and, help with coping from that aspect. As you mentioned, you don't just have to take care of yourself, you're taking care of others. So hopefully from this session, you will learn how to, balance both and take care of yourself as well. So, okay, without wasting further time, I would like to invite Ms. Bineva Umbanusi for her talk. Ms. Bineva, please.
Hello, everybody. Good evening. I believe everyone can hear me.
Yes, we can hear you.
Okay. My name is Vinella Mbansi. I'm a psychologist from the Unforsaken House of Hepzibah Psychological Services. And I must first of all start by saying kudos to everybody out there who is in the cancer journey, fighting cancer, helping people to cope with the condition. So just like Amanda said earlier, the cancer journey is quite a challenging one, and it can even be more challenging for caregivers. Caregivers in this case is not just family members, with the patients, but also, doctors, nurses, every other person that, comes in contact with the cancer patients. So I have this presentation slide here, but I would like to first of all, talk about the burden of care. So in this case, I'm talking about the burden that comes from caring for a cancer patient. So sometimes the diagnosis of cancer, the management of it and things like that, can have like a lot of life-changing experience. It comes with a lot of, emotions, comes with a lot of, lifestyle changes. For some people, it can come with a feeling of, first of all, denial, shock, depression, sadness, and things like that. But over time, reality tends to set in, both for the patient and for the caregivers as well. So in this presentation, we'll be making focus on the impact of this care on the caregivers. So I would call it, for the purpose of this presentation, I will call it burden of care. So what is burden of care? Burden of care in this case means the distress a caregiver perceives or have in the process of caring for a patient who has cancer. Now, it's important that we understand this burden of care because it has a huge impact on how the cancer patient will be managed. So sometimes there are some cancer patients that might be independent or might be dependent on the caregivers. There are ones that it might be difficult for, for them to go about their normal daily activities without, much help. On the other hand, there are ones that, they will have to be, mostly dependent on their caregivers. Now, in this case, a lot of expectations are, on the caregivers, probably the relatives or the significant others of this person. Now, the burden of care can be quite challenging and distressing, and sometimes destructive for the caregivers because they may have to make significant, lifestyle changes for them to accommodate this, cancer patient. And when it comes to that, it might be even more distressing for even the caregiver. So you're not just only dealing with the stress of caring for this person, you also have to make a lot of, sacrifices, a lot of lifestyle changes in order to care for, for this person. Now, in this case, I want to define what burden of care, means in two aspects. We have the subjective burden of care and we have the objective burden of care. So in an objective burden of care, this is the physical, psychological, social, or financial impact or implication giving care can have on the caregivers as a result of certain lifestyle, disruption or changes you have to make in order to care for this person. The subjective burden of care in this case means the physical, psychological, social, or even financial impact it can have on the caregiver as a result of the feelings and appraisals or attitude you have in the caregiving role. So I'll break it down. So in the objective burden of care, this basically talks about the financial, psychological, physical, or social impact giving care can have on the caregiver as a result of the changes that he or she have to make in order to care for these patients. Even for doctors, nurses, medical practitioners that come in contact with this person might also be within this objective burden of care. Now, the subjective burden of care is basically talking about the physical, psychological, and financial impact, even social impact on the caregivers as a result of the feelings and your attitude towards it. So in this case, the caregiver might be having feelings of, guilt, self-blame. Am I giving enough for this care, for this cancer patient? At this point, I will share my slide, so just so that we can have more clarity and at least to have a pictorial aspect of what I'm talking about whilst we proceed. Okay, please let me know if you can see this, and then we can proceed. Can everyone see this, please?
Yes, we can. I can see it from my end.
Okay. Okay, so I want to talk about what caregiving could look like. In this case, caregiving could look like assisting with daily responsibilities like doctor's appointments, preparations, making sure that this person is able to make it to, doctor's appointments, chemo and things like that. Administering medication or assisting with physical therapy or other clinical tasks. The other one is assisting with everyday activities like bathing and using the restroom. Like I said earlier, they are, depending on the stage of the cancer, there are certain stage where the patient will have to depend solely on the caregiver to be able to go about, normal daily activities. And then providing emotional and spiritual support. So in this case, the caregiver is not only giving, his time or her time or resources in terms of maybe energy or money, they're also trying to be there emotionally. And, we live in a world, we live in an environment where, the spiritual aspect of it is also very important. Even in the Maslow's hierarchy of needs, we now have the one who, the transient that talks about, people's belief and faith and things like that. So here in Nigeria, we have, we believe so much on, the spiritual aspect of it and things like that. So you see some caregivers also providing emotional support, spiritual support, probably, seeking out for prayers and all of those things. So the energy, the time, the resources pulled together to ensure that this person is well taken care of can be very disrupting, can be very challenging and distressing. Now, it's important to note that so when stressors become too much, a caregiver may have to do something about it. Stress is normal human. Everybody experiences stress from time to time. At one point in time, there is always something that is constituting a stressor. But it becomes what I call clinical significant when your coping mechanisms or coping capacity now is less than the stressor. So when the stressors become much more than your coping capacity, that is where one can say, I'm becoming more distressed or I'm going through a lot of stress. But normal stress is a normal human, we experience it from time to time. In psychology, we have two different types of stress. We have the eustress, we have the distress. Now, the eustress is the positive one, the stress that comes with planning something good, going through a normal, pleasant activity, but you're undergoing, one or two changes or stress as a result of accomplishing something good. For example, maybe planning a wedding and things like that, or a birthday party. Then the distress is where, there is, a lot of psychological, even physical changes or distress that comes with carrying out certain activity. And in this case, caregiving to the cancer patient. Now, when the coping capacity is no longer enough, is no longer sufficient, and it's now less than the stressor, which is trying to be there for the cancer patient, this is when there is an issue. And this is where clinical psychologists are actually very concerned about. So most of the time, we might not really be big on, something, the normal. We are usually centered on what is abnormal, what is out of place in this case. So when a caregiver suddenly begins to feel a certain way constantly in our field, any behavioral changes or any distress that is prolonged as long as 2 weeks is clinical significant. You need to seek help. I'll come to that by the time I start talking about self-care and things like that. Now, when the coping capacity is no longer enough, the burden of care begins to, come out. The person begins to feel the burden of caring for this person. Now, it becomes even more significant when it is now within the subjective burden of care, which is when someone begins to feel that, oh, I am not doing enough. What am I not being there for this person enough? There might be some guilt feeling, there might be some depressive feeling for a while, feeling that, oh, this person is going through a lot and I'm not even there for them. This is usually prominent or is more significant when the person, the caregiver probably does begin to, go about his or her normal activity without probably giving a care at some point, it might lead to a lot of self-blame or guilt. Or shouldn't I be there for this person? What am I doing here? And things like that. The truth is, you as a caregiver will have to take care of yourself. You need to be like sufficient enough for you to be able to care for someone. I always say that you can't pour out of an empty container. Sometimes you need to be sufficient enough for you to be able to be there for the other person. Because if you don't take care of yourself enough, you might end up even being also dependent on other people in order to cope. So we might need to be careful in the course of, giving that care to our loved ones, giving that care to our patients, giving that care to family members and things like that. At some point, you might need to know when to take a break and, rejuvenate to be able to bounce back again. Now, there are certain challenges faced by caregivers. For example, time constraints in this case might be especially when you have to make some, lifestyle changes. Sometimes people may have to quit their job or work less, or maybe move to a new place in order to accommodate or even make room for the cancer patients. So when all of these things are going on, there might be time constraints on when certain activities should be done and when certain things should be done. So in a time like this, sometimes some of these challenges can come up, and in this case, the caregiver might be put in a fixed situation where it might be difficult to even make an option over the other. Now, self-development difficulties. In this case, it could be something that maybe something leading to lifestyle changes, quitting your job or making some career changes in order to accommodate the needs of this cancer patient. So these challenges might even be more distressing, because at some point the caregiver might start thinking that his or her own life is being put at a halt to be able to accommodate this person. Then physical and health problems, yes. So in this case, because of the impact or the distress that comes with, caring for patients with cancer, there is something we call psychosomatic symptoms. When your mental state begins to even, reflect on your physical state. You're sad, you're not feeling well, you're probably feeling guilty about some things, or you're probably feeling burdened by the finances that is involved with, caring for a cancer patient or a family member living with cancer and things like that. Some of these impacts or some of this distress might begin to reflect on the physical health. The person might not be sleeping well again. The person might not be relating well again. It might start affecting even social interaction. And in this case, it might lead to social withdrawal or social isolation. Even normal places, the caregiver may want to go, but you might be finding it difficult to even go because, one, you might feel that some of your life has been, snapped out of you. You have to make some changes to be able to take care of this person. Then emotional distress. Emotional distress can come when the caregiver begins to feel overwhelmed and sometimes burnt out. So burnout usually occurs when there is a lot of prolonged stress and there is a lot of distress that is not well taken care of. Remember what I said earlier about stress. Stress is normal. It happens. People undergo stress from time to time. But when it's not managed properly, when it's prolonged without proper or adequate social support or coping mechanism, it can lead to burnout. It can lead to emotional distress. And sometimes it might even lead to extreme cases of depersonalization. The person might not feel that need again to even care because stress has been left for a long time without being attended to. So when some of these things begin to happen, the caregiver needs to reach out, because sometimes, I'm happy that we have doctors here as well. We are having more doctors now, even in therapy and things like that. Initially, it was observed that sometimes doctors feel that they have to always be in charge, fix it kind of mode. The fact is, at some point, the person that is perceived to be the helper needs to be helped. He needs to be held by the hand and be able to be helped as well. So even as doctors, even as nurses, even as caregivers who are in the chain of help might also need to take some step back and give themselves the opportunity to be helped as well by seeking, support, social support, reaching out for therapy and things like that. Now, economic issues. This is very vital as well because you and I know that, managing cancer is not cheap. The chemo, the medication and things like that, it comes with a lot of financial implication. And if care is not taken, it might be a major, source of distress or burden for the caregivers. Because sometimes the cancer patient might no longer be in that position where he or she will be able to help themselves or be able to get money and things like that. They might need to rely on the caregivers, the family members, the relatives to be able to raise money for the financial implication of managing the, cancer. So in a case like this is one of the major challenges some caregivers also face. Now, let's talk about the physiological and psychological response to burden of care. I think I've mentioned some of this, but it's important that we begin to identify some of those symptoms and things to look out for. Sometimes, caregivers, when they go through some significant distress or burnout in such a way that they might not even know the time to take some step back. When you suddenly stop sleeping well, you're no longer happy, you're no longer motivated to do certain things. Most people might probably, sweep it under the carpet and say, I'm just okay, it's just this and this. At some point, when it's not properly attended to, a lot has to be done to help this person to bounce back again. Now, these are some of the things or physiological and psychological changes that can, come up as a result of the burden of caring for cancer patients. One is feeling exhausted all the time. Sometimes it comes with excessive crying spells. How will I be able to manage this person and this and that? Getting sick more often than usual. In this case, you might see some changes that comes with the body that, we are probably getting tired. Your body is no longer feeling like it again. You might be feeling sick even more often than you should because there is now stress on the body. The psychosomatic symptoms are now becoming more prominent. I'm having headache, I'm having back pain, I'm feeling this and that. Can be some of the symptoms that come with that burden of care because you're pouring out, you're giving out your support, your time, your money, your resources on these patients. And in most cases, if you're not pouring back in again, at some point it becomes empty. Like I said earlier, you can't pour out of an empty container. You have to constantly, as you scoop out of this container, you have to constantly fill yourself in order to be equipped again to even take care of yourself and be able to take care of others. Now, not enjoying things you used to enjoy before, anhedonia is what I call it. So when you start feeling not, enthusiastic about life, not enjoying the things you used to enjoy because of that burden of care, I don't think it's something that needs to be swept under the carpet or just, dismissed by a wave of hand. You might need to take time and observe some of your own behavioral changes, the caregivers, your own behavioral changes as a result of this, caring for this person. Caring for a cancer patient is never an easy thing. You might not know the impact it may have had on you until you probably take some time off and reflect on how things have been or have changed over time and the things we might need to do in order to bounce back again. Now, withdrawing from people. In this case, it could be from social activities. It could be from, things that used to make you happy or work, as the case may be. Lots of appetite or even overeating. So sometimes when people are sad and anxious, they might eat too much or eat too little. So in eating too much or eating too is a way of numbing out whatever feeling or distress that they are having. So when you see someone eating too much, when the person is sad or not eating at all, it's a way to numb out probably the distress that that person is feeling. Headaches or constant physical symptoms that don't improve with treatment. Now, this is where, we talk about the talking therapy. So we believe so much that the mental state has a lot of impact on our physical state. Sometimes there are certain, medical conditions of, physiological conditions that medications might not really, or fully deal with. And in most cases, it might be as a result of the mental state of that person. So you see someone probably going through constant headache, pain, backache, and things like that. You've been taking medication, it's not working, and nothing is changing. You might need to take a step back and consider, could it be a psychological, response to what I'm feeling right now? And this is where the talking therapy also comes. Now, too much alcohol intake or use of mood-changing drugs. So in this case, the caregiver might, in order to numb out those feelings as well, the person might take too much alcohol or use psychoactive substances. So psychoactive substances, those things that will, begin to cause some changes in the brain activity that may start affecting the way you perceive or the way you act. Increase muscle tension. So you see the person constantly being anxious, being tensed without really relaxing. In this case, it might be difficult for this caregiver to completely relax. The person is constantly edgy, even during bedtime. So that's why it's no surprise when it becomes too much for this caregiver. It might be difficult actually having a good sleep or a quality sleep. Then unexplained and constant anger or irritability. So when in this case, you see the person is constantly angry, is constantly, irritable, probably snapping at people, even snapping at themselves as well. It's not just, so the aggression might not necessarily be external all the time, it might be internal, okay? Excessive worrying, in this case, you see the person worrying about, will this person ever get better? Would there even be any change and things like that? Trouble solving problems, making decisions and focusing. Here, you might probably see this person forgetful, difficulty making decisions or solving certain problems. So in this case, it might be something that, a person used to do on a normal day, and then all of a sudden the person begins to find it difficult to carry out very simple tasks. When such things begin to happen, you have to take a step back and understand what exactly is happening. Then trouble sleeping. Trouble sleeping is another thing, because the person is constantly worried about this person. What if something happens to this person, whilst asleep? Will I be there? And things like that. Now, it's important to also note or mention, things about grief. So sometimes people don't necessarily, so grieving doesn't necessarily, entail when someone loses something or someone. Sometimes people grieve expectation. And expectation in this case is when the person finds it difficult or, does not come to terms with certain changes that have come as a result of this, this cancer journey. The person might be having some level of, oh, this is something I'm expected to have, to have happened. I'm expecting that this person at least would have come to a stage of this and this and that. And when he's not living up, when those expectations are not met, the person might start grieving. And even grief can also present in some of the things I've also noted here as well. Not enjoying things, lack of motivation to do whatever they want to do, and things like that. Even the sleep problems. So grief is not only when you lose something or lose someone. Grief can also come as a result of when certain expectations are not met. You start grieving expectation. You start feeling sad as a result of certain expectation. And then when those burden of care begin to pile up and unattended to, it becomes a problem. So what do you do when some of these things happen? What is the care? What does what does care mean for a caregiver? What does self-care, I would call it, mean to a caregiver? Because a caregiver also deserves to be cared as well in order to be able to care for this person. If you do not take care of yourself, you can't take care of this cancer patient. So you need to actually rate it as important as you feel it is to care for this caregiver or to care for this cancer patient. Now, what are the self-care tips? What do you do? What does self-care mean to a caregiver? First of all, you need to keep in mind, it's important that you have that in mind, that caring for your own mental health and physical needs makes you an effective caregiver. You need to constantly, have a check-in list, weekly, daily, but don't leave it to, pile up for a long time. You might need to come up with a checklist. How am I sleeping today? Has has my appetite changed? Has my quality of sleep changed? My social interaction, has it changed as well? Because you can't be on this journey without social interaction. As important as it is for you to care for your cancer patients, your cancer relative or things like or people like that, is important that you are also able to seek help and seek support from other people. Now, what do you do? What does self-care tips or what does self-care mean to a caregiver? It means taking care of yourself in simple terms. It means taking care of yourself, constantly filling up your bottle as you pour out to your family member, to your patients, to relatives who are living with cancer. What do you do? Now, before I talk about the strategies I have here, I would advise that we have a check-in list every day, every week, every month. So what does that look like? Every day, you have to have your own checklist. What did I do today to fill up my bottle? What are the things I need to do today to fill up my bottle? Because if you keep scooping, if you have like 10 scoops that makes a bottle, if you keep taking 1, 2, 3, 4, 5 till 10, before you know it, your bottle gets empty. And any little kick, it goes that way. It's off here. It's no longer important. But when you take out a scoop and fill it up with 2 scoops or 1 scoop, you are able to gauge, to be able to help. So every day you need to find something, everybody individually, you have to find something that works best for you, because what this person considers a pleasant activity or enjoyable activity might be different from what the other person considers, pleasurable activity. Every day, what do I need to do? It could be as little as listening to music. I'll tell you why I'm talking about everyday check-in, every week check-in, every month check-in. Because when the burden of care becomes too much and unattended to, it might be difficult for you to gauge up to be able to get yourself. I'll explain this with a simple illustration. When you have an empty bottle and you want to pour in water into it, it doesn't get full immediately. If you're filling up a bottle or a jar from a tap, a running tap, it doesn't get full immediately. Initially, before you start running the tap, it's still empty. Any little kick, it goes off. But when you start running the tap, it gets to a certain extent. If you kick it a little bit, it gets resistance until it gets full. When it gets full, it will require a significant impact of a kick for you to be able to run off. Now, what I'm trying to explain here is the everyday tip or the everyday check-in you do is like the little scoops that you put in, including the every week, check-in, is like the little scoops that you put in. You don't have to wait till you completely go empty before you start filling up yourself. Because if you leave yourself to be empty and dry, it will take a significant number of water in quotes for you to be able to gauge. So an everyday tip or an everyday strategy that you need to adopt, even this for doctors, is even more, impactful, the burden of care, on doctors and other medical, professionals, because they deal with a good number of them every day. So it's not only limited to caregivers within the family. It's also extended to medical professionals within the hospital or medical team. What can you do to ensure that you don't take on the burden of caring for your patients or your relatives? Because at some point you might start taking up some of the emotions that are coming from the distress they are going through. Sometimes people will start feeling, oh, maybe I wish I could just take some of your pain and things like that. As much as you're not taking the physical pain, you're also taking the emotional pain, because you're feeling overwhelmed. You go through emotional trauma or distress in the course of caring for this person. So an everyday check-in, and every week check-in, and every month check-in would really help. What that looks like depend on you, but I'm going to give you a guide. What does that look like? Every day, pick something that is doable for you. You can do to help distress yourself. You don't have to wait till Friday. You don't have to wait till weekend. You don't have to wait till you're on a leave on a holiday for you to be able to do that, because it might be too late for you. Even as you're giving that care to the to your relative or to your patient, you can still be doing something whilst you're doing it. It's a way of filling up yourself so that you don't go completely empty. Now, for the everyday check-in, again, what does that look like? You could be listening to music. It could be catching up on your favorite, TV show. It could be something as little as, watching an episode or anything that looks pleasant for you. It could be taking a walk, nature walks, admiring the sky, the birds, and things that it might seem silly looking at the sky, watching things and all of those things. But these are little things that keeps you calm, that makes you relax. Because sometimes when we are caught up in between a lot of activities, when we are caught up in between doing this for this person, doing this for this person, we neglect the things that will make us cope with that challenge or with that distress. So whatever works for you every day, pick it up and do it. Then for the every week strategy, that should come a little bit higher than the everyday. So how I'm rating it is the everyday tips or everyday strategy is everyday pick like whatever it is activity that you want to do. These are things you can easily do with the snap of a finger. Listening to music, taking nature walk, whatever it is for you. The everyday one, the every week one could be probably, going to the movies. It could be probably window shopping. These days, you mustn't necessarily need to, break a bank for you to be able to take care of yourself. Okay, you can do something that you consider nice, even some things you feel you won't enjoy. You might not necessarily know if you're going to enjoy, you give it a try. Sometimes caregivers get so caught up with caring, being there for this person, they tend to forget themselves. Take 5 minutes break. Take 10 minutes break. It's not too much for yourself. It's also a way of giving back to yourself for you to be there for the person, so that you don't end up also being the one dependent. Depression, mental health distress issues can be so distressing that it might begin to even affect your normal daily functioning. So a decision as simple as, am I going to have a bath today, might be very difficult for you to do if your mental state is not really in a state where it's able to function. If you're not able to function, optimally, something as little as, am I going to call this person today, becomes a problem. And when that begins to happen, honestly, in the Western world, we just call them. Is that serious? So we need to work on what we can do to fill up ourselves. So every day, ask yourself, how full is my bottle? How sufficient is the water in my bottle? Am I half empty? Am I half full? Am I going dry and things? Your bottle must not go empty. Before you go to bed every day, you need to do something to fill up yourself. You don't have to wait for a Friday night. You don't have to wait for a Saturday. You don't have to wait for a holiday. You need to do something every day as a way to take care of yourself. Now, as I've spoken about every week, pick up something that is a little bit higher than the everyday one that you have to be more intentional. I've given an example of seeing a movie, visiting a friend, probably a chat is also a way to, build your social support. Remember, the cancer journey is well traveled with a lot of social support. Social support from medical team, yes. Social support from family and social support from the caregivers as well. What is your own social support? Who are you relying on, in quotes, to be able to go through this cancer journey? Now, for the every month, what will you be doing once in a month or twice in a month to cope with this distress? For some people who made life change, who made lifestyle changes or trying to leave their job or move, relocated in order to care for this person. As much as that is quite, life-changing, what can you do to cope with that situation without dwelling so much on the emotions that might not really help the situation? So every month, what are you doing for yourself in order to fill up yourself? It's very important. Okay, with that established, then I'll have to talk about the self-care tips now, or the coping strategies. Like I already said, you have to keep in mind that taking care of your mental health and physical needs makes you an effective caregiver. It's not just being there for yourself. Taking care of yourself as well is also a way of taking care of this person. Now, plan enjoyable activities with family and friends. So even with this person, a family member living with cancer, what enjoyable activities can you guys do? So you might not necessarily do it in isolation of this person. It can be a family get together. It can bring the games home. You might not necessarily need to do a movie, go to the movies outside. You can set up a movie night in the house, pop some corns or buy popcorns, get drinks and things like. Make it lively. It's also a way of making the journey less stressful. Okay? Now, arranging activities that bring you happiness and comfort. This is relative and this is subjective. So whatever activities that are healthy, it's important I note that as well. So we have maladaptive coping mechanisms and we have adaptive coping mechanisms. Maladaptive ones are the ones that are negative: smoking, taking psychoactive substance, engaging in excessive drinking and things like that, even gambling. So all these activities are a way to numb out the feelings. It's a coping mechanism, but it doesn't remove the problem. It doesn't take away anything. It doesn't build your coping mechanism. As a matter of fact, it's self-destructive, it's self-defeating. But adaptive coping mechanisms are mechanisms that will help you cope with the situation. What are those things? It could be visiting a friend. It could be planning a short trip for yourself and things like that. 1 day off, 2 days off is not too much. It's also a way to fill up your bottle again. Journaling. If you're in a situation whereby you might not necessarily need to move out of the place where you are, you might need to write. This is applicable even to the medical professionals. Sometimes a lot goes on in here, in the head, a lot of activities, a lot of distress, a lot of thoughts. Remember, distress most of the time is as a result of distorted thinking pattern. Okay? So when the feelings are becoming overwhelming, you might need to note it down. How am I feeling today? What are those things? It might seem like old-fashioned or things like that, but it's very important that some of those feelings, some of those things you have in your mind is penned down in a book. If you ask me, I would advise a physical journal, but most people will prefer probably to go, write on their phones. It's usually very therapeutic when you need to pen down your feelings. So journaling is very important. It's also a way it's as if you're talking to a third party. It's as if you're trying to pen down or put in writing what exactly it is I have in here. Okay? Exercise is very important. Exercise is very important because it produces endorphins that give you the happy feeling, feel good kind of thing. So it might not necessarily hit the gym. I'm sorry. I know, a lot of people are doing the gym thing now, but if you might not necessarily, you don't have to go to the gym for you to be able to exercise. Exercise could be taking that nature walk I spoke about earlier, or even within the house, skipping, stretches. Stretches are actually very important because it's a way of also making you feel calm. And guess what? Yoga is also a way, it's also a form of exercise and meditation. You can do it within the comfort of your home. So it's just to find a safe space, a safe place where you can listen to your thoughts with no judgment, with no self-criticism. Tell yourself, affirm yourself, speak to yourself in a positive light. It's already a journey to the life of a caregiver is like is like a life. How will I put it? Like, is like people take jobs to be able to care for people. Is a job on its own. The medical professionals will tell you that is a job on its own. So for a caregiver within the home sphere to be able to do this is already like a job on its own. So sometimes you need to like take a break, breathe, deep breathing, like be intentional about your breathing, taking deep breaths in and out, listen to your thoughts, affirm yourself. These are things that can be incorporated within your everyday activity or everyday check-in. 10 minutes, 5 minutes, 15 minutes. It's actually, it goes a long way. By the time you do it over and over again, it becomes part of you and you'll be able to build your resilience towards the cancer journey. Practice relaxation techniques such as meditation and yoga. I've spoken about this already. It's important that you listen to your thoughts in the sense that give time to be on yourself and listen to yourself with no criticism. So sometimes when people, are meditating, sometimes there are some thoughts that keep flying in here and there. It's important that you focus on thoughts that are positive. It might be difficult, but with meditation, with positive affirmation, you'll be able to conquer some of those self-defeating or self-critical thoughts, okay? Then avoid drinking too much alcohol. Like I said, most people take this, go into the psychoactive substances to numb out those feelings. When such things happen, we need to take a break and find adaptive coping mechanism. It's important at this stage to talk about therapy. So I know sometimes most people think that therapy is mostly when, is for people who are going through emotional distress, who have mental health issues and things like that. Even as, psychologists generally sometimes are also stigmatized because of the profession they find themselves. Oh, you people are the ones that treat, mentally unstable people or mad people in quotes. But the truth is, everybody needs therapy, even the psychologists themselves. So at some point, you might need to, seek help, seek for, therapy, seek for, support, help that will help you to cope with some of those overwhelming feelings. So I call it unburdening session. So sometimes a lot, like I said, go in here and there you might not have a way to express it or, dump it. Therapy is a place where you can vent, rant in quotes, and be able to express yourself without feeling judged or criticized. It's a place where you just have to be yourself and say your truth as it is. Sometimes, even the caregiving journey can even be hard, especially when you feel you're not being there enough for your person, or when you feel you're giving too much for your relatives or your family members living with cancer, or for your patients who have cancer. When such things happen, it's good that you find someone you can speak to in order to deal with those feelings. You know why? If you do not express those feelings and if you suppress them, suppressed emotions and feelings have a way to express themselves. And sometimes when they are suppressed for a long time, when they eventually express themselves, it might lead to explosion in quotes. It might be done in a maladaptive way. The person might just start saying things, start venting in a way that is more destructive. now. So it's important that from time to time, seek out help, look for therapy, a therapist to speak to, 1 session, 2 sessions, just a way to help yourself to even build your resilience and fill up your bottle to be able to be there for this, for your loved one who is living with, cancer. Now, joining a support group is also very important. So even in therapy, we have support group or group sessions for people who have similar, issues. We have group sessions for, people who have similar problems, who are going through this, caregiving journey. What can we do? How do you feel in this caregiving journey? Like Dr. Ebuka said earlier, there are times when, the person begins to feel that overwhelming feelings or emotions. How are you able to manage yourself? By the time you realize, you speak to 1 or 2 people who have that similar problems, you realize that you're never alone in that journey. Sometimes understanding or realizing that you're not alone in a journey makes the journey a little bit, it makes it doable. It makes you feel that, okay, at least I'm not the only one going through this problem. At least I'm not the only one who is also undergoing, having these similar feelings and things like that. It will help the coping better as against having it all by yourself. So it's important that as you are caring for this, your loved one, your patient, your relative with cancer, you need to take care of yourself, because self-care is never selfish. It's a way to take care of yourself for you to be there for others. If you don't take care of yourself, in Nigerian, I remember this Nigerian commercial that if this doesn't take care of yourself, who will? So I'm going to adapt it now. If you don't take care of yourself, who will? No one but yourself. Okay, so I hope you find this very helpful. If you have any questions or any clarifications on all of this, I'll be glad to have it as well. I believe that Amanda may have some questions that she might want to share. So thank you so much for your time, and thank you.
All right, thank you very much, Vinella, for that very, very insightful session. For me, it was really amazing because before we started, I remember sharing my own challenge and how I deal with it. And I'm happy to know it's relevant to an extent to what was spoken about today. Something I really grasped on today while Vinella spoke was the need to take care of yourself. You taking care of yourself is the only way you can care for another person. So you should be able to pour into your bottle daily while you're trying to pour out to others. That's caring for people and, helping and giving in the way you can. So thank you once again, Vinella, for that amazing session. So now I would like to open the floor, or rather, the floor is open to anyone who has questions, comments, or concerns that you would like to share with us today. If you are willing, you can also, type your questions in the chat box and it will be read out to the group. The floor is open now. Questions, concerns, suggestions?
Hello, good evening, everyone. Good morning and good afternoon. My name is Chidilim Nwafo. I think it's Dr. Oge, that invited me, sent a link for me for this program. Thank you so much, all the doctors in the house. I, listening to this program had kind of given me a relief or more of made me understand certain things that I kind of went through, or my sister is going through right now. My mom is not a cancer patient, but my mom is diabetic, kind of, and she was in one of my sister's place in Atlanta. I went there 2 years ago to see her and all that, but going to see her, or going to settle my son in school last year, she had moved from my sister's house in Atlanta to the one in Houston, and seeing my mom, from within a space of 1 year, how she has kind of deteriorated, didn't kind of go down well with me, and she now works with a walking stick, and to move from point A to point B, it was a kind of a difficult, and for us to even make a hospital appointment, we kind of miss the Uber will, decline after waiting. I think my own challenge was kind of seeing her deteriorate, seeing her within a space of 1 year, and the next year she has gone so bad. I think that, I don't know what kind of a feeling I would say was it what for me, whether it's kind of a pity for her, for her or something. And, my sister would go to work, and, the care was now left for me, having to give her a bath. How it is, your mom that you used to see, very active, very, how it is. She has to now, I have to now give her a bath. So most times I get emotional. I go into my room, and then, I get emotional. And then I noticed that I didn't even think it was when you are talking about it that I'm not playing everything back. Even got to a time that even, me, that every morning before 9 o'clock or 10, unless I'm having to do my workout, I would have taken my bath. I remember there was time like 5 days I didn't take my bath. And I didn't see it as anything. I would just, take care of her, go into the room, and just on my own and all that. And my sister that she's with, now that I know that, we were thinking that how can she be this, in quote, mean to our mom? How can she be this mean if she's in her house? Now I realize maybe she got into that point that she herself should even go for a therapy. She got into that point that you're talking about, maybe resentment, bottled up a lot of emotions. She wasn't speaking out and all that, and is now lashing on any little thing. She would just hit at you for something ordinarily like she has lost herself, like I keep talking now. So I think I will reach out to to her, or to our senior sister, or to somebody, to even advise her to go for therapy. Like you said, she has bottled up so much, and she's now hitting at everybody, hitting even at the poor woman that is in her house and everything. So thank you so much. I really appreciate you guys. Dr. Oge, thank you so much. I'm very, very grateful. Thank you.
So much, Ma, for sharing your experience with us, and we're glad to know that this session was very insightful and helpful for you. In as much as your mother is not a cancer patient, you can still leverage and use these tips that has been shared today to help yourself, and also you can share them with your sister as well. Hopefully they would help her.
Yeah. I wish I'd invited her to this program, or a lot of us to this program. Caregiving is caregiving, because you're even talking about cancer. This is your mom, diabetic. No, diabetic. She wouldn't eat what she from being strong, making her food in my sister's house in Atlanta. within 1 year to now even able to move, even to walk is a problem. She used to walk, take a walk like, walk for like, do like 5,000 steps a day or something for her age at that time. All of a sudden she cannot move. To move from her room to the dining where, because when I got there, I noticed that my sister would just drop her, keep her food in her room. I said, no, I wouldn't do that. You must take that walk. That's a little exercise. Come out from your room to the dining to eat. Even if it's the only exercise you do, then you'll be able to go back if you want to use the washroom and all that. Thank you so much. Caregiving is caregiving, no matter what, whether it's, it's just that cancer is like life-threatening as it is. Or maybe will the person make it out of it, or is she going to die and all that. Thank you so much.
Thank you very much, Ma. Thank you once again. Okay, now we have Modupe Ali. Mrs. Modupe, please, you can unmute your mic and speak now.
Yes, good evening. Thank you very much for organizing this session. I find it very useful. My concern is how to make this thing like a public enlightenment. Just a few weeks ago, somebody called me and to complain about their sister that is taking care of their mother, that she's not doing enough. Isn't the woman her mother, this and that? Me, my own little knowledge about caring, I just saw that you should appreciate this woman. That it's not easy taking care of people. And I wish she could have listened to you so that she can even appreciate the little, so to say, that the sister has done for the mother. She is not around, but what they hear about the way the sister is taking care of the mother is that she's not doing enough. Sitting with a sick person, not really cancer, maybe even somebody that is dementia, or maybe somebody that is bedridden, it's not an easy thing to do. So my own thing is, how do we get this information to the public? Do we, maybe if we gather people in our place of worship, we educate them, not really, maybe not into this detail as Dr. Mbanusi has done, maybe at least let them know and tell the people that maybe are caring for their sick people, or those that are even watching them, to appreciate them. So is there a way of how we can do this? That is my concern.
Okay, thank you very much, Ma, for sharing that with us. When you talk about making it a public sensitization and awareness, definitely there is a way we can, reach out to people. If you would like us to, host something like this in your place of worship, definitely you can always reach out to us. I will drop our contact information in the chat box, and you can give us a call and we can, work out something with your organization, either your church, your place of work, or wherever it is you would like us to make this sensitization. But apart from that, we also have, we're going to have this uploaded on our YouTube channel as well. So you can always rewatch this episode and share it with as many people as possible who will, exactly, this would be useful. So I have shared our YouTube link in the chat box. I would reshare it again, but we can start from there while we work on, going from place to place, organizations to organizations to create this sensitization. Thank you very much, Ma.
You're welcome.
Okay,
Thank you. Bye.
Thank you. Okay, so we have a question in the chat box from Dr. Oge. So it starts like this. My challenge is sometimes knowing if we are saying what the patient's loved ones wish to hear. I find it sometimes stressful and even guilty sometimes. How does one handle this in a healthy way? Let me take that again. My challenge is sometimes knowing if we're saying what the patient's loved ones wish to hear. I find it sometimes stressful and even guilty sometimes. how does one handle this in a healthy way? So, Vinella, can you kindly answer that question? Thank you.
Okay, thank you, Dr. Oge, for that question. So first of all, it's important to say that as distressing as, communicating cancer issues, is to caregivers or family members of the cancer patients is also very important that you tell them, the reality. Okay. So even as doctors, I know how hard this can be because, you might take on, that, empathy or sympathy for this person and things like that. So to answer your question in terms of how, knowing what the family members will know, the fact is you don't know that. You don't have the supernatural means. But as much as possible, be open, be honest, and communicate to them as it really is. Okay, how they take it on is a different thing altogether. So their reaction is not within your control. What is within your control is communicating what it is or what the reality is to this to the family members. So it's important, they have the right to the truth. They have the right to know what the situation or what the case really is. You can empathize, say, nice words, soothing words and things like that. But you can't, you don't have to put yourself in that savior situation to know exactly what to say to, to salvage or make things, to make them, feel a certain kind of way. Their reaction towards what you say is out of your control. You are feeling this distressed because you are trying to exert control over what you cannot control. So, which is their own reaction or what they're expecting to hear from you. What is within your control is tell them as it really is, what it is, what the situation, what the situation really is, what are their expectations in terms of this is what we are expecting that you do for this patient and things like that. But in a calm, soothing, empathetic way and things like that. But expecting to say it or say things that you want them to, that they're expecting you to say is out of your control. And to feel guilty, if you ask me, yes, it's the guilt is part of it, but the fact is it's even self-destructive, even for a doctor, even for a medical professional. The guilt part of it is you're trying to put yourself in a particular standard that is making it difficult for you to function in a healthy way. The guilt part of it is the human aspect. When it comes, you have to manage it in such a way. What is really the reality here? The reality is this is what is obtainable. This is what the patient is going through. This is how the patient is actually going through this. Communicate it in an empathetic, in a calm way, in the very soothing way you can put it. And then that's it. Put, wishing or wanting to, say things the way you want the family members or to, the way you want the family members to expect it or to hear it is out of your control. So don't put yourself in that distress level because that will also start, you start being, it might lead to self-criticism. Oh, you should have said it this way. You should have done it this way. If you start feeling guilty, if you start putting it in that aspect, it means you're putting yourself in a particular standard that might even be too hard for you to, push through. So I hope, I don't know if that have, answered your question.
Thank you, Vinella. Thank you.
You're welcome.
All right, thank you very much. Do we have any other questions or comments? We can take just one more because we have, run out of time already. Any more question or comment? Okay, so
I have a question,
okay, Dr.
if
Ogi.
that's all right.
All right, definitely.
Sorry, I hope you can hear me. I have a very bad cold. This is a question. How that's I've sort of gleaned from other healthcare practitioners, and sometimes you also sort of think, oh wow, this is a lot. how unprofessional is it to cry with caregivers? You know, when caregivers come to you, it's either, the relatives, sometimes it's even very close friends, and they've been coming to see this patient, maybe they're on admission, or they've come with them for outpatient clinic and they are struggling, and then the patient is not in the space, maybe on the ward, and then they come to you to unburden, and then they start crying, and you know what the journey is. I have heard a few, healthcare practitioners saying that sometimes they can't help it and they actually have tears themselves when these caregivers are discussing with them. It's not like it's something that happens all the time, but, I have found myself on the edge as well. I remember about 2 weeks ago, or is it 3 weeks ago, one of our patients, very, very unwell, came to the clinic. He needed to have some investigations done. They put him to do the CT scan, and he needed to get down quickly because he needed to get to the toilet. But because he was having loose motions, he couldn't even control it. And he, messed, he was incontinent. He had an accident before he was able to get to the toilet. And, we managed to get him to a corner while we got some things, and he was crying. And I felt so bad because this is a man that I already know what he was like in his prime, and to be, in a way, in quote, reduced to this condition, he just kept pointing at his trouser and holding my hand and saying, look at what happened to me. It's completely broke my heart. I mean, I didn't cry or anything, but, under the pretext of let's get this done, I became very busy. The nurses, bless them, had already gone to get change of clothes. We're just busy, but honestly, I could have cried. So the question is, how does one remain human, but you still have to put on that professional, appearance? Thank you.
Okay, thank you very much for that question. So first I will come from the human perspective, then I'll switch to professional perspective. So first, it's okay to cry because you're a human. But then again, you are the professional who, seem to be the one that, have the answers, in quotes, that, have the way out kind of thing. So sometimes when you find yourself in a situation where, your patients are crying and things like that, and you as a human, you also feel that emotion as well. And this is where I spoke about, taking on some of the emotions of, people that you're caring about onto yourself. When such things happen, I would, as much as it's not considered professional to cry, it's still human for you to express that sympathy and empathy for them as well. I've sat in a lot of therapy sessions where, patients or clients will cry most of the sessions, and they will keep, breaking down in between sessions and things like that. In that situation, we usually have like a box of tissue around where we just have to hand them, that tissue to, express themselves. Even in therapy, we advise that they cry. In crying, they are letting go some of those emotions that have been suppressed over time. So you as a professional, as much as it's not considered professional to cry, with your caregivers, but it's also a way to, show that, oh, I'm walking in, in the same shoes as you. I hear you, I understand you. But as much as possible, if you can control it, it's fine. But if you cannot, it's still human again to feel that way. But it still has to be, put in check, so that the other person, the family member, the patient, will also have to lean on you to be able to, move forward. So in that particular situation, a shoulder someone will have to lend out their shoulder to be leaned on, and it's usually the professional. So put it that way, cry, if when it's really like it's uncontrollable, but it's important that you put yourself, together again to be the shoulder they will have to lean on. I don't know if that is clear on that as well.
Yes, that is very clear. Thank you.
Very much, Vinella, once again for attending to all the questions and comments. And thank you very much, everyone, for sharing your experiences and, making this webinar a success by being here. We appreciate your presence. And I would like to close by saying this. If there is nothing you were able to take out from today's session, I would like you to always remember you need to care for yourself first before you can pour out to anybody. Have a daily checklist, a weekly checklist, a monthly checklist to check in on yourself and do one or two things to boost your mental health, boost your emotions, so you can be able to deliver the care that your loved one needs, your patient needs, and you would also be able to, be fine for yourself. Once again, this webinar is going to be available on our YouTube channel. The link is in the chat box. You can click on the link and subscribe to rewatch this session. And we would also send you updates via email for people who registered for the webinar. You would get updates on more of this kind of sessions that would happen during the year and in future. Thank you so much, everyone, once again, and have a lovely day and weekend. Good evening.
Thank you, Amanda. Thank you, Tolu.
Thank you so much.
Thank you so much. Thank you, Vinella. Thank you so much.